discovery itself is really the engine for the medical center, because it's through our research efforts that we'll actually be able to improve lives, not just in this region, but around the world.
Patient care is our primary focus and what we love to do, and it's very important to us. But we're able to extend that care beyond just our individual patients to help do studies that will further the knowledge and understanding of medical disease and be applied to large groups of patients around the world.
It's really a small, integrated community of physicians who really respect each other in terms of the work that people are doing, and they are excited about the discoveries that are happening around them. We don't compete with each other. We're very happy for each other when we see people discovering things that are unique.
At Wake, we are headed towards that form of translational research that really is going to take what we learn in the bench back to the patient's bedside.
Translational medicine really refers to taking laboratory-based or basic science ideas and applying them to patients and asking questions in patients.
There's excellence in terms of knowledge, experience, judgment, and skill. But there is also the very important element of collaboration, meaning none of us are as good as all of us.
The nurses at Wake Forest Baptist are passionate. They're committed. They advocate on behalf of the patients, and they really think about the patient and the family first.
The idea that most of the hospital administration, a significant part of the clinical leadership, including ambulatory leadership, get together and wander the wards and the clinics with specific issues in mind, talking to staff and talking to patients is really different.
Our students come from the Facebook, Twitter generation, and they communicate and learn in different ways than we do. And we have to learn from them so that we can provide them with the best content and the best styles of learning that suits them.
If I could use one word to describe why my experience here at Wake Forest has been so positive, that word would be people.
The faculty here at Wake are wonderful, they're amazing, they always make me feel special.
I've had experiences here at Wake Forest that I will remember for a lifetime.
And it's not only about where you train, it's who you train with, and there are amazing physicians here that I want to train with.
The technology at Wake Forest is wonderful. We're able to get textbooks online, we're able to access resources on the wards. Overall, it really enhances our education at Wake Forest.
I think Wake Forest is a place that combines academic quality, personal attention and community, and a commitment to values and educating the whole person. And I think our medical students reflect that.
Wake was selected as a trial site for the Women's Health Initiative because of the extensive collaboration, skill set, scientific experience, and background in doing research in women. It had an enormous impact for me, for my colleagues. It felt great to know that we were actually enhancing the health and well-being of older women in the United States and worldwide.
We address everything from prevention to treatment. a variety of conditions. Some of the major public health advances people don't even recognize: fluoridated water, sanitation systems, major changes that have improved millions and millions of lives and saved millions of lives are all attributed to public health.
I'm a global citizen. I don't see my patients as just being in my backyard. I don't see borders, and I see patients in need in parts of the world, and I feel compelled to make a difference and help them there. This global initiative began at Wake Forest Baptist, and it's now spread to include clinicians from 60 institutions worldwide.
I think entrepreneurship is a critical part of what we do well and what we want to do better. Our discoveries are only useful if we can bring those to bear for patients.
As you try to recruit the best and the brightest faculty from around the country, you're competing with other universities that have new state-of-the-art buildings. We create space where we can not only create state-of-the-art buildings, but also create that intellectually stimulating environment.
The way that we create tissues and organs is actually taking cells from the same patient. We process the cells, we create the organs in an incubator and place those tissues back into the patient. And by doing so, there is no rejection. The body recognizes those cells as being your own.
Major guiding principle at Wake Forest Baptist is what I call balanced excellence. Simply said, that means we will make equal investments and be equally committed to world-class service and patient care, to world-class research and developing the next generation of cures and treatments for disease, and training the next generation of medical leaders. Wake Forest Baptist will be a leader in that area. We already are.